Hello, everyone, and welcome to Question Lab. We're happy that you're able to join us today as we dissect questions for Step 2 CK. Leading tonight's discussion, once again, is Dr. Paras Vicaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a current dermatology resident here at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school and then went back to do medical school. I'm also an RX coach with USMLE-Rx. So what that means is I work one-on-one with students such as yourselves to help prepare you guys for both USMLE Step 1 and also Step 2 CK, which we're going to be doing some questions on today. And I'm happy to help lead today's session.
I mentioned RX Coach earlier. RX Coach is our tutoring and coaching program. We work with students one-on-one to help them on their academic journey. And we'll talk more about that later. What you should know for now, though, is that the methodology that we will use as we dissect 4 questions this evening will be the same methodology, or similar methodology rather, as the one we use in our coaching program. So without any further ado, let's go ahead and begin with our first of 4 questions this evening on the topic of Step 2 CK. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to dictate or guide your thought process. We don't want you to see an answer choice that you are unfamiliar with. That may cause you to panic as you try to answer questions on test day. So I've gone ahead and removed those. After that, we will begin with the lead-in or the last sentence itself. And the reason we do that is because we want you to know what the test writer is asking, so that when you read that vignette, you can pick up on all of those relevant clues and prevent yourself from having to reread that question on test day. So with that being said, let's begin with the lead-in. We'll do that now. Which of the following is the most appropriate pharmacotherapy? Which of the following is the most appropriate pharmacotherapy? After we read the lead-in, we like to ask our students how many steps they believe this question will require. An example of a one-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment of a diagnosis. And an example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require. And the reason we do that is because we want you to have an organized thought process as you're approaching and answering these questions, so you don't make any careless mistakes and make any missteps. All right, I see responses coming in. Let's go ahead and read that vignette. A 27-year-old woman comes to her obstetrician because of pain and swelling in her left breast. She reports that she has had a fever of 38.3 degrees Celsius or 101 Fahrenheit for the past 2 days. She gave birth to a healthy baby girl 1 month ago and has been breastfeeding every 3 to 4 hours. Her pulse is 80 per minute. Respirations are 16 per minute. And blood pressure is 125/65. Examination reveals focal tenderness just lateral to the nipple with surrounding warmth, edema, and erythema. No fluctuance is observed. Which of the following is the most appropriate pharmacotherapy? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to go ahead and do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so generally starting off with questions, the first thing they're going to give you is demographics. In this case, it's a 27-year-old woman. So you always want to make note of that because that's really going to start to clue you in as to what you should be thinking about your differential diagnosis. Okay. And then also as we're talking about Step 2 material as well, also their age may dictate what diagnostic tests or what treatments you can and cannot do as well. Okay, so also important to make note for that reason. In this case, they tell us what her presenting signs and symptoms are. Okay, and in that case, you also want to make note of that as well. Why are they coming into the hospital? Why are they seeing the doctor? And then a lot of times they may also tell you how long it's been going on. So you can get some measure of chronicity to it as well. Is it an acute picture? Is it chronic? Okay. Now in this specific situation, they give us some more information about vital signs, a recent delivery she had, and then physical exam findings. Physical exam findings are even more important than they already are, especially in step 2 CK as well. Especially with that clinical knowledge, the clinical signs that you're picking up on, we're going to have to take a lot out of it. Okay. So then they're asking us about the most appropriate pharmacotherapy. So I think we've got 2 steps here. One, I think we've got to come up with a diagnosis. And then 2, we've got to figure out what is the best therapy, pharmacotherapy specifically, for that diagnosis. So I think we've got a nice 2-step question here. So let's go ahead and let's take a look at your at the answer choices. And what we see here are 5 answer choices. And usually when we work with students, we recommend that students, when they go through these answer choices, that they actually start at the bottom and then they work their way up to the top. So starting with answer choice E and going up to A. So the reason we recommend this is because a lot of times we'll see students starting at A, they'll start at the top, they'll work their way down, they'll see an answer they'll like and they select it without having gone through all the choices. And then sometimes they'll get that question wrong. So we recommend doing it this way so you don't make that mistake and that you don't bias yourself. So let's go ahead and do that now. Answer choice E, metronidazole. D, levofloxacin. C, erythromycin. B, dicloxacillin. And A, amoxicillin. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. And we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So the poll is open. Once again, we're going to wait until about 2/3 of you have responded. Looks to be a clear favorite already. Remember that there is no penalty for guessing on test day. So even if you're unsure tonight, don't worry. Take your best guess and we'll talk about it and discuss the incorrect and correct answer choices here in just a moment. All right, well, let's see what all of you selected. Looks like the clear favorite here with 53% was amoxicillin, and 36% of you selected dicloxacillin. So let's see what the correct answer is, and the correct answer is B, dicloxacillin. So let's hand it off to Paras so he can explain to us why. Paras.
Thank you, Sean. Yes, this is answer choice B. So let's take a look at what's going on here in this question. So we've got a young female who just had a delivery 1 month ago. She's breastfeeding every few hours, okay? She's got some pain, some erythema, some warmth as well. That, on top of the fever in the setting of lactation, suggests a diagnosis of lactational mastitis, okay? Acute lactational mastitis. It's associated with fevers, and you often have a red, swollen, painful breast, okay? If you had fluctuants, that would indicate an abscess has developed. Well, we do not have that in this situation, okay? So let's take a look at the next slide, and we've gone ahead, we've pulled up some screenshots from the First Aid for Step 2 CK book, and this is the chapter in obstetrics talking about mastitis, okay? It is essentially a cellulitis of the breast tissue that usually occurs within the first couple months of being postpartum. And usually it's from trauma to the nipple, okay? So as a result, those organisms can then enter into the skin after that trauma. And it is usually Staph aureus, okay? So in cases of lactational mastitis, you can see there in the history and physical exam, it's usually unilateral. You can have erythema, edema, warmth, and tenderness, and you can have significant fever like our patient. She had all of those. She didn't have fluctuants, and but that would indicate an abscess like we said. Now the treatment is that you want patients to continue breastfeeding. You do not want that infected material to accumulate. You want them to either continue breastfeeding or use a breast pump if they're not breastfeeding. You want to continue, you want to keep those ducts open. And on top of that, you would want to start oral antibiotics to cover against Staph aureus. Most commonly would be dicloxacillin or cephalexin. You could also use amoxicillin with clavulanate, not amoxicillin by itself. Okay, the brand name for that is Augmentin. You could also use azithromycin or clindamycin if they had an allergy or could not tolerate penicillins. Okay, so if you go back to our question, there was nothing there about a penicillin allergy, nothing there about that. So dicloxacillin would be the best choice here. Metronidazole is used more for gram-negative and gram-positive anaerobic bacteria, so not good for Staph aureus. Levofloxacin covers a wide variety of both gram-positive and gram-negative bugs, but not Staph. Erythromycin can be used for some strains of Staph aureus if you have a contraindication to using a penicillin, but we do not have that here. And then lastly, answer choice A, amoxicillin. Certain strains of Staphylococci produce penicillinase, and so you would want to give a beta-lactamase inhibitor like clavulanate with amoxicillin. So amoxicillin clavulanate, not just amoxicillin by itself. So answer choice B is the best answer here.
Excellent. Thank you very much, Boris. Tough question, but great job, everyone. Hopefully, that explanation will help you master and nail this material on test day. Let's move on now to our second question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the most appropriate next step in diagnosis? Which of the following is the most appropriate next step in diagnosis? I'll give all of you a moment here to let us know how many steps you believe this question will require. And then we'll move on to the vignette. All right, I see some responses coming in, so let's go ahead and take a look at that vignette. A 2-year-old boy is brought to the emergency department by his mother. Her mother says she noticed the child limping on returning from daycare yesterday and notes that bruises occurred 1 week ago when the boy bumped into a coffee table in the living room. The patient has moderate intellectual disability and was born at 34 weeks. Gestation after a pregnancy test that was complicated by preeclampsia and gestational diabetes. Physical examination shows 2 large, tender, ecchymotic areas on the anterior aspect of both his thighs. It is otherwise normal. Which of the following is the most appropriate next step in diagnosis? Boris.
Thank you, Sean. So once ahead, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we've got a much smaller, a much younger patient. We've got a 2-year-old boy, so a nice pediatrics case, okay? And then in this situation, he's brought to the ER for a couple things, limping after returning from daycare yesterday, okay? They also give us some more information about some bruising, bumping into a coffee table, intellectual disability when he was born, other physical exam findings as well, okay? So all of these, like we said, we need to use all of these clues to kind of piece them together to come up with what's going on in the situation, or a diagnosis, for example, okay? So that's kind of what they're asking us. They're asking us, what's the most appropriate next step in diagnosis, okay? So I think this is probably maybe a 2-step question. I think maybe figuring out what's going on here, and then what would we want to do to diagnose it. Now remember, in step 2 CK, there is a little bit more of an emphasis on diagnostic modalities, okay? So that's something you're definitely going to see there, okay? So let's go ahead, let's take a look at these answer choices, and let's see what we're working with. Answer choice E, skeletal survey. D, whole body CT scanning. C, complete blood count, prothrombin time, and partial thromboplastin time. B, CT of the head. And A, antero-posterior and lateral films of both femurs. So we're going to go ahead and open up that poll. Go ahead and select an answer choice, the answer choice you think is the best answer. We'll talk about it in just a few seconds.
I know the answer choice C is truncated due to the character limitation here. So that is going to be complete blood count, prothrombin time, and partial thromboplastin time. We'll give all of you a few moments here to lock in your responses. Let's take a look and see what all of you select. It looks like 71% of you selected answer choice C, complete blood count, prothrombin time, and partial thromboplastin time. In distant second place with 14% was skeletal survey. So let's take a look and see what the correct answer is. The correct answer is E, skeletal survey, and 14% of you got it right. So a challenging question indeed. With that, I'll hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question here. So what's going on here? Let's take a look at this question a little bit more in depth, okay? So if we look at our vignette, we see that this is a 2-year-old boy, right? And he was born prematurely at 34 weeks, and he does have moderate intellectual disability, okay? The child is limping, and then there's bruises, right? After supposedly bumping into a coffee table. There's also 2 large bruises on the anterior aspect of both of the thighs. Now, if you can imagine a young child, that's commonly, if you were to grab very forcefully a young child by their legs, your thumbs and your hands would be right on those thighs. So that's actually a common place where you can see signs of abuse, child abuse, okay? So some other common signs of child abuse include bruises, belt marks, bite marks, cigarette burns. We commonly learned in step 1 about spiral fractures of the bones, okay? But whenever you have bruises over areas like that, you definitely want to think about child abuse, okay? Now, if we take a look at the next slide, a little bit more about child abuse. From our first aid, our step 2 CK first aid book, okay? So if the history doesn't really fit with the physical findings, okay, or there's other things suggesting abuse, you definitely want to make note of that, okay? So what are some risk factors? Well, you know, parents who have a history of alcoholism or drug use, or children who have intellectual disability, because oftentimes parents have a difficult time raising them and can get frustrated, and so they can take that out on the child, and that would be considered child abuse. Okay, so if we move to the next slide, it talks about what are some of those examination findings. So bruises, the most common physical sign of abuse are bruises, and they're usually geometric, so from your hands, from a burn, from an object, and usually found in atypical places like the face or the thighs. It's not very common as a 2-year-old to get bruises on your thighs, okay? Burns or other fractures or even retinal hemorrhages as well, other things to think about when talking about child abuse. So in this case, we would want to get an X-ray skeletal survey to see if there are other old injuries, other old fractures that may not be evident. Okay, so that is what we would want to do next for the diagnosis, for the management of this case. So if we go back to our vignette and our questions, hopefully you guys are picking up, now you can see that when we go through that vignette. Let's talk about the other answer choices, why those would maybe be less correct. So I think CT scanning is done maybe if you're concerned about a cancer. I think the answer choice C with CBC, PT, and PTT is if you're worried about a hematologic abnormality. But at this point, I think it's more important that we work the patient up for child abuse. There's really nothing specifically at this point that's concerning or that makes hematologic abnormality jump out first outside of the bruises. Okay, a CT of the head. You know, there's really nothing here specific about head trauma, so I don't know if that would be the most appropriate next step. You know, and you could consider x-rays of the femur. However, keep in mind that would only show you any fractures of the legs. The purpose of a skeletal survey is to show you if there are any fractures or injuries in the whole body. Okay, and that would be more helpful than just getting an x-ray of the legs. So child abuse, not just child abuse, but elder abuse as well. These are things that we have to start thinking about when we see patients in the hospital setting and what would be the next step in diagnosis and management. Okay, so a good question here to always remind you guys to keep that in the back of your mind.
Well, thank you very much, Boris. Once again, a challenging question, but great explanation, and hopefully that'll help all of our students get it right on test day. Speaking of helping to get things right, we have a coaching program, and we work with students individually to help them master the material they need to succeed while they're in medical school, for their comp exams, for their shelf exams, for their step exams, as well as, of course, to become great physicians. We have tutors and coaches just like Boris. If you're studying for a step 2, the first thing we'll do is have you take an assessment, and it will base your study plan, a personalized study plan, on that assessment. Same goes if you're studying for a comp or for step 1. If you're still in school, right, we will work with you to make that plan based on your syllabus or learning objectives. Once we have the study plan in place, you'll work individually with our coaches to implement that study plan, ask questions that you have, and of course, do practice questions together with guided self-study, along with being provided our resources to really identify your knowledge gaps and bridge them, but also work on your test-taking skills. Oftentimes, students are studying and they say that they're studying, but their results aren't matching their efforts, or they're not making the progress they'd like to make. It seems a little inefficient. They seem like they're spinning their wheels. So we can help make these more efficient for you. We can help make sure that you're on the right track and use our expertise to guide you. We've created our own resources. We're one of the only tutoring companies that's been in medical education prior to tutoring. And so we have a lot of wonderful data we can use to help you really master the material and maximize your potential on test day. So if you're interested in learning more about RX Coach, you can visit us online at rx-coach or rx-coach.com. You can click on the free consultation tab. And once you click on that tab, you'll be able to schedule a free consultation to discuss the coaching program and how it can benefit you. Once again, that website is rx-coach.com. So with that being said, let's go ahead and move on to our third question of the evening. Once again, the answer choices are covered up, and we'll begin with the lead-in. Which of the following is the most appropriate next best step in management? Once again, I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. All right, I see the responses coming in. Let's take a look at that vignette. A 38-year-old man was thrown from his motorcycle and brought to the emergency department by emergency medical services. The paramedics report that his initial blood pressure was 74/52. Pulse was 128 and respirations were 33. He was given 2 liters of lactated ringer solution en route, and medical anti-shock trousers were applied. On arrival to the trauma bay, his blood pressure is 78/56, pulse is 125, and respirations are 28. On examination, pelvic compression elicits severe pain and blood is noted at the urethral meatus. Which of the following is the most appropriate next best step in management? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? So once again, we think demographics are important here. We have a 38-year-old male, and as you had read as Sean had gone through the question, you could tell it was important because we talked about a urologic injury, okay? So he was thrown from his motorcycle, okay? Then they give us some vital signs, both when the paramedics saw him and then when he arrived to the ER. And then there's some important physical exam findings there as well. We want to use all of those once again to get us a picture of this clinical scenario. Okay, so just imagine you're there in the ER and you're given this information, okay? So then they're asking us, what is the most appropriate next best step in management? So I think we've got a couple steps here. I think one, we've got to figure out what's going on, what's the diagnosis, the clinical situation, and then 2, what's the next step in management of this patient, okay? So let's go ahead, let's take a look at those answer choices. And once again, we're going to start at the bottom. We're going to work our way up to the top. Answer choice E, retrograde urethrogram. D, intravenous pyelogram. C, Foley catheter insertion and urinalysis. B, administration of blood products. And A, abdominal ultrasound. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer here, and we'll talk about it in just a few seconds.
Once again, the poll is open. We'll give all of you a few moments here to select the best response. Let's take a look and see what all of you selected. It was kind of close. We had 41% of you select abdominal ultrasound. Second place, we had administration of blood products. And in third place, we had retrograde urethrogram. So let's see what the correct answer is. And the correct answer is B, administration of blood products. And 28% of you got it right. So let me hand it off to Paras so you can give us a nice explanation. Paras.
Thank you, Sean. Yes, definitely another tough question. So what's going on here? So we've got this 38-year-old man, right? And he just had a bad accident, okay? He was hypotensive, tachycardic when the paramedics first saw him. They gave him 2 liters of fluid. He comes to the ER and he's still hypotensive and tachycardic. That's not great, okay? And it's not even that much of an improvement in those vital signs as well, okay? Now we do know he's bleeding. There's blood at the urethral meatus, and there's severe pain on exam. So we are worried about a urethral injury and internal hemorrhage, especially when we see that blood at the urethral meatus. So what we need to do is we need to stabilize this patient. That's the first thing we need to do. So as you can see, this question was asking us, as we highlighted, the most appropriate next best step in management. It wasn't asking us which test is going to diagnose his issue. It wasn't asking us what's the gold standard of diagnosis, what is the what step would is the ultimate step. It's saying, what do we want to do first? What is the next step? The next step, and we've got to stabilize this patient. He's unstable. He's hemodynamically unstable. Okay. So we've got to stabilize him. So what does that mean? Well, let's take a look at the next slide. And we've kind of talked a little bit about this, but trauma management, okay? So the ABCDEs of trauma. So whenever these patients come to the ER, you'll notice that we do this thing called a primary survey, where we go over these 5 things for all patients who are considered trauma patients who come to the trauma bay. The first thing we do is we assess their airway. If there's anything, any sort of compromise to the airway, that's the first thing we need to secure, okay? We check their breathing, then we check their circulation. Now in this patient, as you can see there, has been given some fluids. He's been given a couple liters of fluids. If the patient remains unstable, even after giving fluids, especially in the setting of concern for bleed, you would want to consider a transfusion with blood products, okay? So that's what we would want to do first for this patient. We want to give him some blood products because he's hemodynamically unstable and we know that he's bleeding, okay? So let's go back to our vignette. Let's go back to what was going on here, okay? So the first thing we want to do is we want to give blood products. And then after that, you could talk about maybe taking him to surgery if he needs surgical management of a fracture, of a urethral injury, okay? But you can only do that once he's been stabilized, hemodynamically stable, okay? So let's talk about the other options. So a retrograde urethrogram would be good as a diagnostic modality for the urethral injury, but we don't want to do that just yet. We've got to stabilize it first, okay? An IV pyelogram, that would be more, one more for a kidney, and also again inappropriate at this time. A Foley catheter insertion, you do not want to insert a Foley catheter. It's actually contraindicated to put that into a urethra when there is concern for a urethral injury. Now we know there's blood at the urethral meatus, so we would not put a catheter into the urethra, okay? Because that could worsen the trauma. And then lastly, an abdominal ultrasound, that could also be a diagnostic test to consider to figure out what might be going on here if there's a question as to that. But again, not the next best step. The most appropriate next best step is to give him blood products to help stabilize him. Okay, so it's always important, especially with these step 2 CK questions, we need to go through what's the very first thing we need to do. When this patient comes into the ER, what's the first thing we're going to do? And we're going to stabilize him. Okay, so always important to make note of that.
Excellent. Thank you, Paras. We've got some challenging questions tonight. Let's try to finish strong with our last question of the evening. Once again, the answer choices are covered up, and we'll begin with a lead-in. Which of the following is the most appropriate next step in patient care? We'll go ahead and read that vignette because this is the same type of question as last time. An 8-year-old boy is brought to the ED by his father due to left-sided pain after a bicycle accident 4 hours earlier, where he was thrown from his bike and the left side of his body hit the handlebars. The pain is vague and radiates to the left shoulder. He denies dizziness, somnolence, headache, blurry vision, or vomiting. On arrival in the ED, temperature is 37 degrees Celsius, 98.6 degrees Fahrenheit, pulse is 97 per minute, respirations are 22 per minute, and blood pressure is 105/65. Exam reveals left flank abrasions and ecchymosis, with tenderness to palpation and dullness to percussion of the left upper abdominal quadrant. Laboratory workup and CT of the abdomen are done, and the findings are shown. You can see the image there. White blood cell count, 8,900. Platelets, 360,000. Hemoglobin, 12.1. Hematocrit, 38. Mean corpuscular volume of 87.2. Sodium of 134. Potassium of 4.7. Chloride of 101. Calcium of 9.1, bicarb of 23.1, and glucose of 95. Which of the following is the most appropriate next step in patient care? Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And you can see this is a little bit of a longer question, okay? And this is our 4th time doing this. So hopefully you guys are starting to pick up on what are those important clues in the vignette and the question that we should be picking up. If you guys remember, we had one question where there were some important clues in that child case that pointed us maybe towards child abuse. And then the last question, there were some important clues in the actual lead-in that asked us specifically about the best next step, okay? So hopefully you guys are starting to get a sense of that as well. So this case, we've got another pediatric case. We've got an 8-year-old boy, and he's got some left-sided pain after a bicycle accident. So another trauma case, and he's coming back, and he's now in the ER, okay? So important to make note of what are his presenting signs and symptoms, and how long ago was it, okay? They give us some information about the pain, vital signs, physical exam findings, okay? All of which are important to make note of. They give us some lab findings there, and we've highlighted some that we think are relevant and that we would highlight if we were going through this. And then they also give us a CT finding. Okay, so like we said, diagnostic modalities are definitely stressed more in step 2 CK. So it is very important to be able to recognize and diagnose what you think is going on based on imaging findings, okay? So then they're asking us about the most appropriate next step in patient care. I think we've got a couple steps here again. One, what's going on, what's the diagnosis, and then what's the next step in caring for this patient, okay? So first, let's take a little close-up at a larger view of that CT scan so you guys can get a good view at that, okay? And so you are gonna have to recognize CT scans, just like with step 1 as well, but really need to know your anatomy. You really need to know a lot of the diagnoses that you would see on various views of different imaging modalities, CT, X-ray, MRI, PET scan, things like that, okay? So don't worry, that image is still gonna be there just in the bottom right-hand corner. So now we'll go ahead and let's take a look at the answer choices. Let's see what they're asking us. Okay, or sorry, what choices they're giving us. So once again, I'm gonna start at the bottom and work our way up to the top. Answer choice E, chest X-ray. D, supportive care. C, fluid resuscitation. B, exploratory laparotomy with splenectomy. And A, diagnostic peritoneal lavage. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. We'll talk about it in just a few seconds.
Well, thank you very much, Boris. The poll is open. This is our last question of the evening, so let's try to finish strong. And of course, at the end, we will have our raffle and special offer. For those of you asking, next week's topic is neurology. So we'll give all of you a few moments here and wait until about 2/3 of you have responded. All right, I see the responses coming in. Let's take a look and see what all of you selected. The clear favorite here with 50% was exploratory laparotomy with splenectomy. In second place with 17% was fluid resuscitation. And in close third place was supportive care. So let's take a look and see what the correct answer is. And the correct answer is D, supportive care, and 16% of you got it right. So definitely some challenging step 2 questions, but don't feel bad. That's why you're here. If you pay attention to Boris, you'll get it right on test day. But even more importantly, you'll be able to help your patients once you become that physician you've been dreaming of becoming. Boris.
Thank you, Sean. Yes, absolutely. Very important. So another tough question. So let's actually jump to the next slide real quick. Okay, we'll talk about that CT scan first. And you can kind of see those red arrows there. Okay, so that's talking about, and you guys probably picked up on this, but blood. Okay, there's some blood in the abdominal cavity. Okay, and you can kind of see there that within that organ on the left, there's a little bit of kind of some irregularity in going kind of within that organ. That's a little bit of like a cleft or a little bit of like a laceration of the spleen. So the spleen and the liver are the most commonly injured organs after blunt abdominal trauma, okay? So blunt abdominal trauma can injure the spleen or liver, and you can have signs and symptoms of blood loss, okay? So hypotension, tachycardia, and you can also have what's called care signs. So you get shoulder pain due to diaphragmatic irritation, okay? Also with spleen rupture or spleen laceration, okay? So let's go back, let's take a look back at our vignette and talk about what's going on, okay? So this patient had an injury to the left flank. We're told that there's abrasions and ecchymoses, there's tenderness there, there's some dullness to percussion, probably the blood that's in that cavity that's making that percussion dull, okay? So this patient probably has a splenic injury, and we can tell just from the blood on the CT scan, there's probably a splenic laceration. So these organs can also have lacerations just like our skin, and those lacerations can bleed, okay? So now let's take a look, and what's important here? Well, this 8-year-old boy, he has a splenic laceration, but his vital signs actually look pretty good. His blood pressure is 105/65. His hemoglobin is a little low, 12, and his hematocrit is a little low, but not to be unexpected. You know, he has lost a little bit of blood in his abdominal cavity, but he's hemodynamically stable, okay? So in patients who are hemodynamically stable, we don't necessarily need to rush them to the OR to open up their belly and take out their spleen, okay? Depending on the severity of the laceration, these lacerations can heal, okay? And a lot of times what we do for mild lacerations is we keep them in the hospital and we monitor them serially with physical exams, and we repeat and check their vital signs, and we check their blood counts very frequently. And if at any point they decompensate or their blood counts go really low or their vital signs drop, then you could take them to surgery. But there's a high chance that this could be a very low-grade splenic laceration, and we don't need to do a very invasive abdominal surgery on an 8-year-old boy and take out his spleen, okay? That might be a little bit too much just at this stage, okay? So conservative management would actually be the best step here. Hospitalizing him, monitoring his blood counts, doing physical exams, that would probably be the best step. Now, if he were hemodynamically unstable and he was continuing to bleed, then you could talk about taking him to the operating room. But we don't need to do that just yet, okay? Now, fluid resuscitation, so chest x-ray, probably not as relevant here because this is an abdominal injury. Fluid resuscitation is a good thought, but again, he's hemodynamically stable. So what would be the purpose of giving fluids if he's already hemodynamically stable? Okay. A diagnostic peritoneal lavage, that would be useful if patients are unstable or we're not sure exactly if they're bleeding or not in their abdomen. And from the CT scan, we already know they are bleeding. So doing a diagnostic peritoneal lavage to see if they're bleeding doesn't really help us. We already know that there is a little bit of a bleed in the abdomen, okay? So I think the tougher answer choice is answer choice B. And in this setting, because he's hemodynamically stable, we don't need to rush back and take him to the OR. And that's something with step 2. It's sometimes a balance between when do you take them to the OR and do an invasive procedure versus when do you monitor them. And a lot of those important things, just like we talked about last time with your primary and secondary surveys, is there airway compromised? Is there circulation compromised? These are the kind of clues that you're going to have to rely on to dictate, hey, what's our next best step, okay? So a little bit of a transition, as you can see, from step 1 material to step 2 material, but it's a little bit more clinically relevant, and you guys will use this in your everyday practice as a physician. So definitely something to look forward to. So great job with today's questions, and I'll pass it back to you, Sean.
Well, thank you very much, Boris. Great job as always, and thank you everyone for attending. We, hopefully we were able to teach you a few things. If you want to review these questions on your own time and review them further, simply make note of these question IDs. You can log in to USMLE-Rx, type these in, and they'll come right up for your review.